Welcome to this special episode of Thrive With Us. Today, I'm joined by Dr. Rania Ayat Hawayek, specialist pediatrician and founder of Circle Care Clinic. We are going to be talking about the link between physical and mental health and some of the observations that she has made at her center. Welcome, Rania. It's so nice to have you today.
Thanks, Sarah. It's really nice being here.
So why don't you walk us through the link between physical and mental health and how some things that might be psychological are manifesting themselves physically and vice versa?
I mean, this time of year, we do see quite a bit of this, especially with exam pressure. We see it in an age group of patients that we don't often get in the clinic, the tweens and the teenagers who don't often come to us with illnesses, but they do present with symptoms such as headache or recurrent sore throats. Abdominal pain seems to be a favorite one and actually can present from when they're younger. We see our fair share of tics. And as a pediatrician, you can never as a first reaction, say, oh, this must be psychological. You have to go through the motions of the examination, even consider doing tests, because you're often faced by a parent who's anxious for the child and a child who's either not as communicative about it or who really believes that they have something physically wrong with them. So it's such an interesting area.
Yeah, it is. It is definitely interesting. And I think that on paper, people understand that physical and mental health are linked, but there isn't always this understanding of how it presents. And I think the natural thing for people is if your child is complaining about something or if you're noticing that they're experiencing some physical symptoms, to make the assumption that there is a health concern. And so I would imagine that you're doing a lot of the screening, and then you have to work your way through, like, what could this be? What are the differentials? What are some of the tests? At what point do you think, or do you discover that there might be something psychological at play?
I mean, as time goes by, you do become a little bit more experienced and you can sometimes pick it. And very often they give you the clues. Very often the mom will say, oh, he's missing an exam today. Or it's the time of year, like right now with all the 15, 16-year-old and their GCSEs. I mean, my daughter's going through this at the moment. It's that. And also when there isn't much in the way of physical signs. So for instance, with abdominal pain and, they don't have any other symptoms, they don't have constipation. You have to go through all of that. Or you notice that there are changes in familial circumstances. They've recently, let's say, lost a grandparent, or there are some changes in the family dynamics. Or with the younger ones, there's a new sibling that's come in, a newborn that's come into play. And you can start picking up on that. But I do find that it is my job, obviously, to go through the screening for physical issues. But that in its own right also has a placebo effect on many of these children. Sometimes they need the reassurance that there's nothing wrong with them, and the parents need that. And before you know it, the issue, when it is a small issue in the background, goes away. But there are many times where I've had to refer to teams like yours to try and bring in that input. And sometimes I do that in parallel when I do have an inkling that there is something there, especially if there are exams coming up or something, or as I said, a grievance or something. I will run physical tests in parallel, and I will mention talking to someone because of the anxiety of the symptoms. And I try and sort of sell it that way to the patient because I do feel that even if there is something small physical in the background, having that support from a mental health team does really add so much value.
So it sounds like in the intake or screening or diagnostic process, what's happening is you are looking at all of the different physical symptoms, the manifestations, and then you're zooming out and kind of placing the patient holistically in their context. So you're thinking about the family factors, you're thinking about any significant psychological stressors they might be experiencing individually or kind of more broadly. And when you're noticing that, all of a sudden you're having, tummy issues and feeling nauseous right around the time that you're having exams, which is a perfectly reasonable kind of feeling to be nervous or anxious, but it's impeding, it's disrupting your day-to-day functioning. There might be something there. Do you ask about mental health history as part of that process?
Not often, not directly. In the lead up to that, I will sometimes ask, how are things in the weekends? Do you ever feel like that in the weekends?
Okay.
How are things during holidays? And then very quickly you do realize that there's this, like aha moments, you know, on the face of the parents, or even on the face of the child when they're quite in tune and quite astute. I will sometimes to the parent ask discreetly. Helps when the parents are bilingual and the children who are meant to be bilingual are not. I will sometimes ask discreetly and say, have you noticed any anxiety? Do you believe there's something there, something going on? I mean, do you remember we at the clinic do have long consultation times, but you need quite a long time
Yes.
to try and tease all that out. Yes, so in essence, I don't officially ask. Maybe I should. I don't officially ask, but it's when it's implied. Yes, I do delve into it.
Yeah. What you're saying makes a lot of sense because, I mean, when you ask questions about physical health, even for us, those questions are often much better received because people feel a lot more comfortable. And a lot of times you have to be very delicate about what you're asking. And it sounds like you're able to kind of assess for when there might be an issue or challenge, and then very gently, as I know is your approach, guiding them to the resources that they might need, whether it's in the clinic or out of the clinic. And so what I'm hearing you say as well earlier on is that even when someone is presenting and feeling anxious about a physical health condition, you recognize that sometimes having that psychological and emotional support can help them navigate those health problems, whether it's short, medium, or long term.
Absolutely. And it ranges age to age. So when I see the younger ones, especially with the arrival of a new sibling, you do see it. If the first child or older sibling is, you know, slightly older, like they're 5 or 6, this is such a shock to their system.
Yes.
Sometimes some of them regress. Some of them start bedwetting when they never did before. Some of them start throwing tantrums, and it's a completely new thing to the family. And then you have 2 or 3 patients to manage, you know, the parents, the child, the carers, everyone. It's I think any pediatrician, it's one of those areas. I think everything physical health is connected to mental health, and I think it's great to have that awareness as a healthcare professional. But in pediatrics specifically, so much of it is connected to mental health. So much of there's a lot that the child presents with that could be incepted based on, you know, parental anxiety, and children by nature. I don't know. You're the expert on this, but I sometimes find that when something does make them anxious and does take space in their thought processes, it seems to make its way into their gut, makes its way into their system. Some of them just become more sleepy and tired. Some of them, you know, develop nightmares, and then that's slightly more obvious. Abdominal pain tends to be one of our biggest. It's one of the most common presentations of a chronic condition to pediatrics, and I would say constipation would be the number one cause, and the second cause is probably non-physical.
Thank you for sharing that. And I think what would be really helpful and informative for our audience is if you can maybe talk us through some of the different cases or situations where you have noticed that someone presenting with something physical, like you said, in terms of like a stomach or digestive issues, you've discovered that there is a psychological component as well.
Yeah. So that example, for instance, because it is one of the most common, a particular patient comes to mind who did have a little bit of constipation in the background. So it would have been very easy to dismiss those repeated presentations of abdominal pain with that. But when you teased through that, we had found that there was a nanny that had left, that had been looking after this child for such a long time, was replaced by a nanny that they hadn't connected to as well. They had moved house as well. So there are quite a few changes. And once we teased all that, and I remember this child, this was a young child, this was a 5 or 6-year-old, play therapy really helped just to bring out those things. We did have to treat the constipation as well. And it was easy for us to tell the child, oh, you have tummy pain because you're not going to toilet as often, so you need to take this and this will help. So for the child, that felt like a way out. It felt like it explained it. And then the play therapy on the side helped. And then I recently saw them a year later, and things are very, very settled. Other examples, for instance, I remember a 15-year-old girl who I've known ever since she was born. She's one of my first patients in Dubai, and she presented with fainting episodes. She's very sporty. She's quite tall. Like your typical 15, 16-year-old, she may not be as good a meat or protein eater. So it was very easy to pin it to something like a low ferritin or low iron. And when we did her blood test, it was true. she was running slightly low on those. So again, this would have been very easy to dismiss as, okay, here's your iron, here's your vitamin D, get some sleep, all of that. But then she kept coming, even when her numbers had corrected. She kept coming back with these fainting episodes. And she's a very quiet, very good student, not one you'd think. But by the end of it, it did emerge that she was being bullied at school and she was having trouble with certain, classmates. And when the parents intervened and settled, things went away. So the point is, again, and it sounds like we're repeating ourselves, but it is something we see every day, where never dismiss. I would say, to never dismiss a physical symptom. But if the physical symptom, it doesn't make sense for the physical symptom to still be there, because children should not continue to complain. They should not continue to have pain or discomfort. If it continues to be there, you have to delve into the other aspect, the mental health aspect. And invariably there's something, and it could be small and seem insignificant, but to that child, it's everything. And it's just knowing and connecting with the right people to refer to, and knowing how to approach it with the parent, all of that. That can be quite tricky.
No, definitely. And as you were sharing about the first case, what came to my mind is this concept of change. And some of the changes that you were describing were probably quite difficult, like having, someone that you're very used to caring for you, and then having someone new who might be wonderful, but that connection or bond hasn't been formed yet. I think sometimes people also don't recognize that even a positive change, something really, really exciting, is still a change. Absolutely. And that can be stressful, particularly when there's a cluster of changes that happen at once. And so I'm thinking about, as an example, something that a lot of people experience is, for instance, moving to a new house, even if it's your dream house that you've been preparing for so long, or even not moving into a new house, but completely transforming the
changing
space.
Where your bed is in
exactly.
the room. Any of that, exactly.
Yeah. For some children in particular that are a little bit more reluctant to change, more sensitive to change, that can be a little bit more disruptive. And I also think what you're saying makes a lot of sense in terms of zooming out and seeing how are they being impacted. So fine, they're experiencing chronic issues with their tummy. They're having some sleep disturbances. But what else is going on in the other domains of their lives? Are those domains being impacted? Is this athlete no longer able to compete, or have we noticed a big dip in their performance? Are they disengaging socially, whether it's from their family and people that are quite close to them, although that does kind of happen normatively at a certain age, like the teens and tweens, as you were saying before. Are they pulling apart from some of their friends? Are they all of a sudden really not wanting to go to school? Are they dropping things that they used to be interested in? So how are they engaging with all of the other domains? And if there are any shifts, then that probably is a sign that something might be amiss.
Absolutely. And it's very difficult for working parents, particularly parents with lots of responsibilities, to make the time or have the time, because very often these children are very good at just ticking along. And you're absolutely right. It's important to dive into it. And I think the message I would want to give out to any parent or any carer of any child in a situation like this is, don't feel bad that it's taken you so long to actually go seek help. Because sometimes it does take the awareness that something has been going on for that long, because it's hardly ever so drastic that it affects their performance so much that it's obvious. You may notice a drop in their grades slightly. You may notice that they're a bit tired and walk out of training for whatever sport they're doing occasionally. You may notice slightly more sort of sadness or slamming the doors. But I mean, doesn't every teenager do that? So I think the message is, don't feel bad as a parent.
Course.
Bring them in. And that's why we insist on annual checkups for children, once they get over a certain age where they don't necessarily need to come in for vaccines. And we insist, like I would say that we're all trained to take a social history, a family history, and to always remember, when you don't see a child for 3 to 6 months, it's important that you refill that gap in your history taking, because things change. Just like you said, it could be the position of the bed, could be the location of the house, it could be the country, could be a family member, could be anything.
Yeah. And I love the message that you're sharing, which is, don't feel bad. At the end of the day, parents, whether they're working in the home, out of the home, we're busy. We have so many things, and it's very easy to miss things, especially when they're not severe. Yeah. If someone is noticing a very, very strong collection of symptoms or a very sharp change, it's almost easier in a way
Absolutely.
because it's like, okay, there's definitely something going on here. Let's go and explore that. But in most cases, I would imagine it's not so clear cut. And the knee jerk reaction for parents, because of a lot of different things, and myself included, is
Yeah.
you go to the doctor first,
Yeah,
the medical doctor
exactly.
first, and then from there, you know,
Yeah.
hopefully have these kinds of really thorough social histories and examinations, consultations, and identify that maybe there's something that we can do. And one of the things that I want to emphasize to parents as well, on top of, you know, don't beat yourself up for this, is we also don't have to wait until things are severe.
Exactly.
We can promote well-being.
Exactly. And sometimes it is a quick fix. Sometimes it is, here are some iron tablets and suddenly the energy's back. Sometimes it is, here's a stool softener and suddenly
Yes.
It very often is, actually. It's the ones, the sort of the, I would say less than 50% that aren't, that we're focusing on here, because they're the ones that linger. You know, and I will often open my file and say, oh, I haven't seen you in 2 years. You still have tummy pain, you know, and this is where it's something, okay, you know.
Yes.
So it's, it's such an interesting area. It's an area I've been thinking about more and more lately, because this time of year specifically,
Yes.
you do get that. You even get it with the, you know, 17, 18-year-olds with their university applications,
Yes.
you know, oh my God. It's such an interesting area. And I wish we had more, like, I wish part of my work had more time, or was able to give more time to that, because I feel it's an area where the child who believes they are healthy mentally does need the support, and sometimes shies away when you say you need mental health support.
Yes. Yes.
So it's a more of a mental well-being area, actually.
Exactly. And just like with physical health, we know that early intervention is key, and there's also prevention and promotion. So when someone is referred to an external provider for mental health support, it doesn't have to be forever, and it's not about digging out all of the skeletons in the family closet. Sometimes it's just a matter of, hey, something difficult is going on. This person is struggling with this. What are some, you know, tools maybe for the older children? Some reenactment play, sand tray therapy for the younger ones, some family counseling as well, so that parents can kind of help support and do that. And sometimes I would imagine for parents that are a little bit reluctant, a good place to signpost them to is the counselors at school.
Absolutely. Absolutely. It's an area that's more comfortable for the child. It can be woven into their school day. It doesn't feel so taboo as, you know, being driven somewhere for an appointment with someone who understands your brain, because this I'm quoting from a patient of mine. And I do, the way I sort of explain this to many of my patients, I say when I speak to the, you know, the 10, 11, 12-year-olds, I'm speaking to them directly. And I say, you know, this is someone who's not emotionally involved, but who understands how we should be organizing our thoughts and would just listen to you and help you with that. And the nice thing is that they don't know you, and they don't need to know you.
Exactly.
And, you know, they're not connected to you. And when you sort of say that to them, a lot of them, and it's so interesting, I would say ever since COVID, it has become more accepted. And with that younger generation, it has become something that they, just like neurodiversity has become a buzzword. And with that younger generation, I'm amazed at the positive you know, sort of reaction they have to it. This is similar. They do understand that anxiety is a thing and can be addressed. And, you know, so I just find it such an area. We can talk about this forever.
Yeah, and I agree with you. I think it has become a bit more destigmatized. I think COVID helped that along. I think there's been a lot of like government initiatives here in the UAE to kind of promote and highlight the importance of all of this. And that's really positive. But the part that's a little bit tricky, as you were referencing earlier, is the patient is the child, but the patient is also the family.
Completely. Exactly.
Yeah.
And you may have the child accepting of it.
Exactly.
And the parent saying, what are you trying to say? I came to you with tummy pain.
Exactly.
Yeah.
But it sounds like there's a lot of rapport that's built and a lot of trust with all of your patients and the long-term ones. And then there's different signposts that we have in the school that's a lot less confrontational. For parents, it's easier for them to do. And a lot of times those school counselors, they're well trained and equipped and also resourced externally. So if it comes from them that, hey, your child would actually benefit for something a little bit longer term, more targeted, more specialized outside of school, then hopefully that will result in the child getting the care and the support that they need.
Absolutely.
Yeah.
Yeah.
Okay. Well, thank you, Rania, for your time. I
Thank
think
you.
everyone will be able to recognize more than before that physical and mental health are very, very much connected. Sometimes the physical presentation is a sign of something that is psychological in nature. There's no shame in
No.
experiencing that, asking for help, and that kind of holistic support, wraparound care can be really conducive to meeting the needs of the child and the broader family system.
Yeah, absolutely. And I would say when you say sometimes the physical symptom has a background or basis that is mental health, I would say always the physical symptom has a mental health aspect too. And I think that even when you're treating a child for something physical completely, you always have to take into account the impact that has on them mentally.
Of course.
And that to me is something that's evolved as I've grown in my career, and I recognize more and more now. And I
Yeah.
would like to keep woven into my practice.
Yeah, I couldn't agree more. Thank you so much again.
Thank you.